I would like to introduce you to the latest non-compliance Class II corrector, developed and perfected by an international team of orthodontists. My name is Jim Eckhart. I practice orthodontics in Manhattan Beach, California. My teammate in this endeavor is Doug Toll from Bad Soden, Germany. This is an instructional video on the MARA appliance. The name MARA comes from the initials Mandibular Anterior Repositioning Appliance. It's a device to correct Class II malocclusions, and like any mandibular advancer, it works by continuously holding the mandible forward for several months while remodeling occurs until the Class II is corrected. One of the biggest trends in orthodontics today is the shift away from conventional headgear to non-compliance devices. This is because fixed repositioning appliances guarantee predictable results which are not dependent on patient cooperation. These benefits enthuse orthodontists, staff, and parents because they eliminate the constant challenge to encourage, motivate, or badger children into wearing the unsightly headgear with its negative image. Benefits to the orthodontic practice also include improved efficiency and profitability, due to being able to extend appointment intervals without sacrificing predictable results. Like the Herbst, the MARA has the immediate benefit of improving the appearance of the chin. However, differing from the Herbst, the MARA allows greater range of movement because the 4 first molar attachments are not linked. And, compared to the Herbst, patient comfort is much improved by keeping the appliance in the molar region where more room is available, reducing cheek irritation. The MARA is versatile and is designed to be useful with a number of supplemental appliances, braces, and arch wires, thereby catering to the wide range of treatment options employed by orthodontists throughout the world. The MARA is a simple, sturdy appliance that can be easily mastered by both doctor and staff in a short period of time. The MARA consists of stainless steel crowns on the first molars. The crowns are very easy to fit. In fact, 5 sizes cover nearly the entire spectrum of sizes, much simpler than bands. But crowns are needed in order to withstand the leverage forces generated by the attachments of the device. Attached to the upper crown is a large square tube. Into this large square tube is inserted a large square wire called an elbow because of its bent shape. The upper elbow is designed so that it hits the lower arm and does not allow the mouth to close unless the patient holds the mandible forward in Class I. The upper elbow and lower arm mutually shield each other when the patient bites in Class I so that the buccal projection of the lower arm does not annoy the cheek. After being worn in the mouth for approximately a year, the device causes the following anatomical changes. The mandible grows forward via condylar growth and/or remodeling, if growth remains. The growth at the condyle may be a combination of apposition on the condyle head and bending or change in shape of the condyle head. Normal maxillary forward growth is somewhat restrained due to the backward pressure on the upper jaw. The lower teeth migrate forward relative to the mandible due to the forward pressure on the lower molars. The upper teeth migrate backward relative to the maxilla due to the backward pressure on the upper molars. The fossa of the TM joint may remodel anteriorly via appositional growth, or the temporal bone may rotate forward to help seat the condyle. This forward rotation of the temporal bone may be caused by the forward pull from the ligaments shown here, which are stretched by the advanced position of the mandible, and also by the forward pull from the muscles shown here, which are also stretched by the advanced position of the mandible. In general, the torquing tool is used extraorally to hold the elbow without damaging its square corners while torquing the elbow for better fit in the mouth. Necessary in order to use the MARA well are the following. A crown removing plier produced by Ormco. This plier is a modified band remover with a long post to help lift a crown off a tooth. A small beak 3-prong plier used to bend the elbows to fit more comfortably. There must be enough space between the beaks for the wire to be able to flow while being bent.